On this edition of the Super Healthy Human Podcast, I want to welcome friend and colleague, Dr. Dani Williamson. I call her a doctor. She's actually a nurse practitioner. She's a functional medicine nurse practitioner. She has a thriving practice in Franklin, Tennessee, which is right outside of Nashville. And Dani is just a dynamo. She is a ball of positive energy. I really love her energy. But Dani has really devoted the last decade or so really changing her view on healthcare and how she practices and how she works with patients. And she's released a book. It's called Wild and Well, Dani's 6 Common Sense Steps to Radical Healing. And I'm really excited to have Dani on here. We're going to be talking about a subject that I really think is an important subject, Hashimoto's thyroiditis, which is a common condition that I see in a lot of women in particularly. It's an autoimmune disease where the body erroneously is attacking the thyroid tissue, and it's really quite common, much more than conventional medicine would lead you to believe. So this is one of my favorite topics, and I know you as a thyroid expert and Hashimoto expert, this is really going to be a podcast that people are really going to tune into and get so much out of it. Because I think, in the public's eye, when you start talking about TSH and T4 and elevated and, is it high, is it low? It's so easy to get confused, right? So I'm so glad you're here to unmuddy the water, clear everything up. So welcome to the podcast.
Well, thank you so much. I appreciate it. I hope I don't make it muddier, but I'm pretty good at just breaking it down to common sense on it. But yes, I love the thyroid. Had no idea this was going to be my specialty when I was in school, because the endocrine system completely freaked me out in school. And now it's all I do is endocrine work for the most part, gut and endocrine. Yes, I love it.
Well, so if you can't tell, as I mentioned in the intro, Dani's from right outside of Nashville, from Franklin, Tennessee. So we've got the Southern twang between us.
Yes.
Hopefully, but she talks as fast as I do. So even though we're Southerners, we talk pretty fast. Well, listen, what I'd like to do is let's define what is hypothyroidism. What is the definition of hypothyroidism?
Well, the common sense definition is, without getting into all the technical terms of it, is it's a sluggish thyroid. Your thyroid is not working properly. You're producing actually too much TSH, which we don't have to get into all of that, but you're just sluggish, versus hyperthyroid, where things are revved up and your metabolism is really fast, and you may have weight loss and heart palpitations and diarrhea and anxiety and eyes bulging. Hypothyroid is where your metabolism is slower, and maybe weight gain, dry hair, dry skin, eyebrows falling out on the outer side there, higher cholesterol, miscarriages, depression. I mean, good Lord, the list goes on and on and on. And just not feeling well, not feeling optimal, sluggish. This is the master gland. Right? This is the master gland right in front of your throat there. That little butterfly-shaped gland controls 100% of your metabolic function in your body. You can't live without it. When it's gone, you must be medicated, when the full thing is gone, for the rest of your life on thyroid medicine. So it's very important to protect it and take care of it. And when it's hypo or sluggish, you're just not on your A game.
Yeah. Yeah. So hypothyroidism, well, the thyroid is the master gland, right? It controls every cell, every function in the body. And that's why there's so many symptoms, as you mentioned, a whole list there of symptoms: brain fog, anxiety, depression, irritable bowel, dry skin, tingling in your hands and feet, cold hands and feet, dry hair, losing the lateral third of your eyebrows. So all these things are connected to when your thyroid slows down, and so it contributes to these different problems. Now, how is hypothyroidism? How is it typically diagnosed?
by going into your physician or your healthcare provider, and they check a TSH, a thyroid stimulating hormone. That is pretty much the only thing in traditional medicine that is checked, right? And if your thyroid stimulating hormone is elevated, and so it's an inverse reaction. And when the TSH is elevated, then there's where we get into, that's how you're diagnosed hypothyroid. And it depends on what labs you're using.
Yeah.
We use Quest, and it's like your TSH level is 0.40 to, I think, 4.3 would be the normal range, which we know normal ranges are incorrect for most people. And if it's above 4.3 or 4.5 or 5, it's considered hypothyroid. But most providers don't do anything about that, even if I had a patient this week, 5.83 in the emergency room. She was going for something else, 5.83. She doesn't even have thyroid problems. Well, she's hypothyroid. Her primary care provider said, it's no big deal. Let's just wait and see what happens.
That's so frustrating.
It was awful. I was so mad.
Yeah, it happens all the time. But, so I've been doing functional medicine for at least 20, 25 years. And one of the things I love about thyroid in particular is that if you can find low thyroid in one of your patients, it's a game changer, right? And it's missed so often. So let me make sure we clarify this. So your TSH, which stands for thyroid stimulating hormone, when that is elevated, goes up above the norm, whatever the parameter is. And you said Quest is 4.3. I think in LabCorp it may be 4.5, something like that. Mm-hmm. It depends on where you're at in the country. I work with patients all over the North America, and depends on where you go to get the test. But somewhere between 0.5 or 0.4 and 4.5 is kind of the norm.
Yes.
And so if your TSH is elevated, that's a sign that you have a problem with low thyroid function, correct?
Correct. That is correct.
Yeah.
If your TSH is low, then you have a problem with hyperthyroid function, right? Yeah. Too much thyroid hormone going on. It's inverse. It confuses providers and it confuses patients. And many patients will come in and their TSH will be low and they'll think they need more thyroid medicine. I'm like, no. Complete opposite.
Right.
The TSH is the opposite of the free T4 and the free T3, which is what I look at. And I'm sure that's what you look at as well. The circulating hormones, the free T3 and the free T4 in the body. So yes, higher TSH, hypo, or more sluggish thyroid.
So it's very confusing because you'll have, your patient will come in and say, "Oh, Dr. Dani, this test, my doctor said that my thyroid is a little low."
Yes.
Well, what does that mean? It means that do you need more thyroid, or does it mean you don't need thyroid? So I always encourage my patients to get a copy of their tests. And I always, and I'm sure you do as well, I always look at these tests to see exactly, what their doctor said probably has no, they're interpreting it the wrong way.
Correct.
You mentioned in your practice that you're looking at not just TSH, which is in the normal conventional practice, you look at TSH, and maybe if you're a real rebel, you're looking at T4, right? Maybe free T4. But that's just a snapshot of what's going on. It really doesn't show you a complete picture of what's happening with your thyroid function. So that's you correct. And we do additional tests, right? What are some of the tests that you do? What are the tests that you do for your patients?
Always a free T4, always a free T3. And many patients will come in with a TSH, and then the lucky ones will have had a free T4 checked from their provider. Rarely do they have a T3, even a total T3 or a free T3. And I look at a free T3, which shows us, and so those that are listening, your T4 really doesn't do much for metabolism or energy or anything like that. It's dependent on converting in your body through different pathways to free T3. Free T3, I tell patients, that's the gas pedal of your body. That's what gives you your energy, your get up and go, your metabolism, your good skin, your good hair, the maybe some weight loss possibly, and just your get up and go is the T3. So always look at a free T3. I tend to look at a reverse T3 many times and see, are you converting over from T3, which is usable in your body to be able in your blood to give you the energy, to reverse T3, which is useless and tells me, maybe the patient has a lot of stress or has a lot of, may have an infection or inflammation going on in their body, the higher that reverse T3 gets. And every patient gets thyroid antibodies on the first visit. If they don't have Hashimoto's, then I don't check that every time, but they get thyroglobulin antibodies and thyroid peroxidase antibodies checked. I have an antibody panel at Quest, and TPO and TGA. 90+% of all Hashimoto's patients have a positive thyroid peroxidase antibody, which is a marker for Hashimoto's, which is an autoimmune condition of the thyroid and an inflammatory response in the thyroid. TSH, free T3, free T4, reverse T3, and thyroid antibodies. That's the first visit.
Yeah, I totally agree. So why is it in conventional medicine that all they're looking at is TSH and maybe, like I said, if you're real radical, maybe a T4, and they don't even look at these other labs that you and I depend on? It's a routine that we always are checking these to see if there's anything that we needed to adjust with a person's thyroid.
Yeah, they weren't taught about it. Number one, I believe that. I know I was in nurse practitioner school. I was never taught to check anything other than a TSH. TSH is the gold standard. That's what we go off of everything. All we need to know is TSH. So they didn't know. You and I stepped out of the boat and we learned that, oh, wow, there's way more than a thyroid stimulating hormone. There's other hormones, and then there's antibodies. Holy cow, that can change the entire course of a patient's thyroid journey. I think they don't know. And many of them, they don't want to know. They are on an insurance model, which I'm a direct pay practice, and it's all about insurance and what's going to pay and what's going to pay. And they're just not interested in learning. I've got many providers who tell my patients, there's no reason to check a free T3. It doesn't matter. I'm not giving you any liothyronine or T3. Not going to do it. I'm not going to prescribe desiccated pig thyroid. There's no so there's no reason to check it. They also believe there's no reason to ever check thyroid antibodies for Hashimoto's thyroiditis. And that was what happened to me. That's how I got started in this 11 years ago. I failed to check the antibodies on a man, which we know Hashimoto's affects women 7 to 10 times more than men. And I didn't check it. And a chiropractor, he left me and went to a chiropractor, and I was right out of school, and he came back to me and he said, my chiropractor checked my labs, and Dani, I have Hashimoto's thyroiditis. And I was like, what? I was brand new. And I swore then I would never miss it. And then when I started reading about it, I was like, holy cow, this is the #1 undiagnosed autoimmune disease in the United States. Why aren't we checking this? Why didn't I learn about this in school? So now everyone gets checked, and it's become the bulk of my practice. I don't know that I'm an expert, but it is clearly my focus in practice is Hashimoto's. And case in point yesterday, last patient of the day, she was a follow-up patient from a new visit, 61 years old. I did a full thyroid panel on her, along with everything else at the first visit. Her thyroid antibodies, her TPO, thyroid peroxidase antibody, was at 187 or somewhere around there, a little bit below 200. TSH was 2.6. Free T3 and free T4 were really nice. They were good. They were robust. And she feels great. 61. Those antibodies clearly had been there for a long time, because anything above 9 with Quest is a positive thyroid peroxidase antibody. Yeah. She said, you mean mine are 190 something? And I said, yeah. She said, how come I didn't know this? I said, I have no idea. So then she got all stressed thinking she had, and she does have an autoimmune condition of the thyroid. She sure does. Yeah. But she feels great, and she doesn't need thyroid medicine at this point. She feels fine. She may. But if that went on and on and on as it has done, she eventually would flip into hypothyroid, and nobody would have ever known that she has an autoimmune condition that we can work with beautifully to lower the inflammation in her thyroid.
There's so many potential problems with labs for thyroid. So number one, you got to get a doctor to run the TSH minimum, and a lot of doctors will do it maybe once every 2 or 3 years. Number two, you need to, with the TSH, the parameters have changed, at least in functional medicine. I know when my first book on fibromyalgia came out in 2003, I remember talking about the American College of Endocrinology had stated, they came out a position paper that said anybody with a TSH at 3.0 or above should be considered hypothyroid or low thyroid and should be a candidate for medication. But here we are, this is 2021, and we still have labs and doctors, as you said, who acknowledge that a person has a problem with their thyroid, even when their TSH is well above 4.3, 5.8, whatever it is. Oftentimes they'll tell them, you're fine. So number one, you need to realize that the TSH, when we're talking about, Dani and I are talking about it, your TSH really should be somewhere between 1 is what I look at and 3. And ideally, for some people, even down to 2, and even some people really need to be down to 1 if you're on prescription medication, really, really optimizing that thyroid. We're as different on the inside as we're on the outside. So for one person, they may need a more aggressive approach than another. But we talked about TSH, then we talked about ideally you want to get free T4 and free T3, and I like to get free in total T3 and T4. And then you mentioned reverse T3. We'll talk about that in just a second. And then the antibodies. So there's a whole group of labs that ideally you be getting to make sure you don't have a problem with your thyroid. So the big question I get asked when I explain to somebody, oh, you've got the beginning of Hashimoto's, and you probably had this, like your patient just mentioned, you probably had this for a long time and it's causing many of your symptoms. Why don't conventional medical doctors and endocrinologists, hormone specialists as well, why don't they check for thyroid antibodies? It's not something that they normally check for.
No, same reason. They don't care, and they don't believe it changes the course of the treatment. That's the big reason. But even if they did check it the first time, or you had it checked from someone else and you went into the endocrinologist because maybe you had a nodule or what have you, or your primary care said, well, I don't know what to do with Hashimoto's, send it endo. They won't even check it again, ever. I hear this all day, every day, because I have to work hand in hand with only a handful of endocrinologists. And they tell the patients, it doesn't matter. There's nothing you can do about it. The antibodies don't matter. There's nothing you can do. Right. You can't change that. What? I have patients every month bring their antibodies down to near remission, if not remission. Yeah. And that's hard work. And we can talk about that. How do you lower thyroid antibodies? Same way you lower inflammation in your body. And then with a few little extra tweaks. The thing is, they just don't, they're not taught. They don't care. I can tell you that about it. And they are taught, here's your pill, here's your pamphlet. And your pill is 99.9% of the time always going to be levothyroxine and probably generic, not branded Synthroid.
Yeah. So in conventional medicine, they don't have a way to treat Hashimoto's until, so Hashimoto's, the definition of Hashimoto's is an autoimmune disease where the body erroneously attacks the thyroid tissue. And over a period of time, as the body is turned on itself, attacking this tissue, you start to lose thyroid function, and eventually the thyroid burns out, and it's no longer works properly. At some point along that way, the TSH elevates, which is a sign you need more thyroid, and once it gets to whatever that is, the conventional doctor will say, oh, well, now we can put you on a synthetic levothyroxine or Synthroid or something to address the problem of your thyroid. The challenge with that, as you so well know, is that these patients for a number of years, oftentimes, they've been having all the symptoms of low thyroid that we mentioned earlier, and they continue to go back to their doctor and they get a TSH, which is normal. And the doctor says, oh, everything's fine, come back in 6 months. Finally, 3 years go by, and they're tingling in their hands and feet. They're on, they're probably on Neurontin and they're on stuff.
Yes.
They're on Klonopin to help them sleep
Yes.
because of anxiety. They're on, Miralax for their constipation, IBS. I mean, they're treating these symptoms. And the whole problem is that for the number of years, they've been developing this Hashimoto's thyroiditis.
Right.
And they just get lost. They just kind of get lost. So what sets us apart is that when we see the beginning of Hashimoto's, we can actually treat the underlying causes of this autoimmune disease rather than waiting till the thyroid is burned out and putting them on a synthetic medication. So what are some of the causes of Hashimoto's?
Oh my goodness.
It's a long list. What are the most, so let's do it this way, Dani. What are some of the common causes of Hashimoto's?
Well, of course, inflammation. So you could have your viruses, your Epstein-Barr things that could trigger anything that's going to trigger an inflammatory response. Could be, for me, I have lupus. So mine was triggered with bad diet and irritable bowel syndrome. So that triggered lupus. But in general, women have autoimmune disease 8 to 10 times or so more than men. We are the most toxic. So when you think about thyroid, think about your lotion, your lipstick, your nail polish remover, your shampoo, your conditioner, your deodorant, your toxic tampons, your toxic personal care products. I mean, the list goes on and on and on. Here's the nose. Here's the thyroid. So you're breathing this in. You're very close proximity here. That inflammatory response from constant assault of chemicals, that's a huge piece of the puzzle with Hashimoto's thyroiditis. I tell patients, you don't put anything near your thyroid ever. You don't put what you put on your body, you put in your body within 26 seconds flat, pretty much. So, and then stress can cause Hashimoto's thyroiditis. Stress will kill you.
Yeah, it's the big
inflammatory diet, right? Gluten and dairy. Gluten's the number one inflammatory agent for the thyroid. When a patient is diagnosed with Hashimoto's thyroiditis, they are immediately asked, if they're not already asked, to go gluten-free, because gluten really attacks that thyroid and mimics, an inflammatory marker there. Dairy, number 2, is a big one for Hashimoto's thyroiditis. So there's multiple reasons for Hashimoto's thyroiditis, just like any autoimmune disease. Some horrible preceding event, some stressful event. The problem is, this, when a patient has one autoimmune disease, the average is 3 autoimmune diseases, and Hashimoto's and multiple sclerosis kind of are like sisters, or Hashimoto's and celiac disease are real close together. I have a lot of patients with both of those. I'm lucky with lupus. I have lupus and that's it. But I put that under the radar the last 11 years, which is great. So there's multiple reasons for that, and an undertreated thyroid as well. It's not being treated properly, the thyroid, and not properly medicated, right proper prescription, creating systemic inflammation in that thyroid. Inflammation is the root of 100% of all chronic lifestyle diseases you were not born with: high blood pressure, high cholesterol, diabetes, the list goes on.
So the two evil villains, as I call them, is inflammation, chronic inflammation. Inflammation can be a good thing at times, but
you bet.
Chronic, uncontrolled inflammation, and stress. I mean, those are the two catalysts for most every disease, if not every disease. And in particular for any individual's hypothyroidism, that's really one of the driving things is stress, poor sleep, stressful lifestyle, poor diet, toxicity issues, medications you're taking that can compromise the thyroid. I mean, it's a whole list, but definitely stress. And the number one cause of low thyroid or hypothyroidism is Hashimoto's.
Yes, number one reason for hypothyroidism is Hashimoto's thyroid. And it's the number one undiagnosed autoimmune disease. So it makes sense to check your antibodies when you're checking the TSH. But yet again, which is the reason I wrote this book, the tagline is Common Sense Practical Medicine. We don't practice a lot of common sense.
Yeah, absolutely.
Yes.
And so, the thing is, as you mentioned, someone brings in a lab test, to their doctor, and the doctor says, oh, you got elevated thyroid antibodies, but your TSH is normal. So we're just going to watch it.
Yes.
The same thing when you go and they get, an ultrasound, they see these little nodules and they say,
yes.
Oh, and by the way, you got these nodules and you got elevated antibodies. We went ahead and checked those. We're just going to watch it. And, my initial reaction to that always when I hear that is, yeah, we're just going to watch you get further and further in the gutter. I mean, you're not even going to be, eventually you can't even get out of bed. You're so exhausted. We're just going to watch you go downhill, and then eventually we'll put you on Synthroid, and, we'll hope for the best. But that approach just seems so ridiculously simple-minded to me.
Criminal to me.
Yeah. Yeah.
And again, maybe they don't know better, but once we know better, we know. Yeah. And then we help those patients get their life back in order by decreasing the environment, the inflammation in their environment, and their cleaning supplies and all the things that create inflammation, and eating well and helping them, know their food sensitivities and decrease the inflammation by cutting out the foods that they might be sensitive to and eating clean one ingredient food. I mean, it's a whole process to this that's not rocket science, right? Sleeping well is huge. Your body heals when you sleep. So, and then we get into the entire thing, and we're going to talk about this, of what medicine you're taking. Yeah. Because that makes all the difference in the world. Yeah. A generic thyroid medicine, I do not write a prescription for generic thyroid prescription in my office. I probably have, out of hundreds of patients, 2 patients, maybe 3 on generic. They came to me on generic and they felt fine. And so they did not want to change. And, I'm a big believer, no matter what I think or believe on that. I mean, don't monkey with something if it's working. Yeah. Even though I don't write that. And there's a reason we don't use generic thyroid medicine. By law, it can be 20% underactive to 25% overactive. All generics can. All generic. That does not matter with Benadryl. Who cares if you took Benadryl and you got 25% more? You just sleep better. Who cares? Or you feel better. With thyroid medicine, you cannot do that. Or a medicine that's has a narrow therapeutic index, meaning changes in that dose, slight changes in that dose, can change the levels in the blood. So patients say, well, my doctor says that generic thyroid is exactly the same and my insurance will pay for that. It's only $4 versus $30 a month, for Synthroid or something. I say, no, it's not. Has your doctor been having to check your labs and your TSH is elevated one time, which hypothyroid, or very low the next time? And are they constantly having to adjust your thyroid medicine? Yes, Dani, they are. Mm-hmm. That's because you're getting a different manufacturer every time. And you may be getting, say you're on 100 micrograms of Synthroid, you may be getting 75 micrograms one month, but 125 micrograms the next month. Yeah. Thyroid is dosed in micrograms, and aspirin is milligrams, 325 milligrams. You pop an aspirin if you need an aspirin, literally micrograms. So I am a big believer, unless it's absolutely necessary, you never use a generic thyroid medicine. And if you do, you get your thyroid medicine 90 days at a time, and you ask, the provider asks, same manufacturer every 90 days. That's a long shot. Yeah. But maybe. Yeah. Well, I want to go back and clear something up. And then I want to talk about what you brought up, just about the prescription part of it, because that's a whole nother topic, but we need to clear that up as well. I think it's important. So with Hashimoto's thyroiditis, we've already pointed out that the body is erroneously attacking the thyroid tissue. In conventional medicine, they typically, if they ever see those antibodies, they'll just wait till the thyroid is to the point where it's disintegrating, basically. Yes. And then your TSH goes up. So now you finally can get the diagnosis of hypothyroidism. They put you on typically synthetic medication. Yes. The difference between that approach and our approach is that you mentioned that we're looking at these different causes. So yes. It's not that you have a hormone deficiency.
You don't have a synthroid deficiency or a hormone deficiency. You've got a deficiency of the function of the thyroid gland because it's being compromised. And what we want to do is we want to look at what is it that's making the body attack the thyroid tissue. Same thing in any autoimmune disease, which you specialize in as well. With an autoimmune disease, we want to know is what is causing the body to attack itself. So you pointed out different toxins, chemicals that people come in contact with, gluten, food allergies, viruses, low vitamin D levels can be a catalyst, anemia, some of these things that can create, Hashimoto. So the difference is in our approach, we're looking at when we see those elevated thyroid antibodies, no matter what the TSH says, we're already thinking, okay, what do we need to do to stop the body from attacking itself? And then we have these protocols that allow us to do that. So then going to the other part, what you start talking about were the different medications. So one thing that I think is important that we clear up, as you mentioned earlier, that we both check reverse T3. So we're checking to make sure that T4, which is really the inactive thyroid hormone, is converting into the active hormone T3. I mean, you basically could live without T4, but you would die without T3. You have to have it. Very few conventional doctors ever check that.
Absolutely.
So one of the challenges, I know you see this in your practice, is you have patients that will go to their doctor every 6 months. They get their blood work done. They're getting their TSH checked. And the doctor says, oh, everything looks good. Meanwhile, Jan can't get out of bed. She's gained 40 pounds. She's depressed, anxious, elevated cholesterol. Her hair's falling out. But her doctor's saying, oh, yeah, we've got you on Synthroid, a synthetic T4 medication, and your TSH looks normal, so stay on that dose. So there's a whole host of different things that could be going wrong in that scenario, right?
Mm-hmm. Oh, absolutely. Absolutely. And so, I have no problem putting them on a little tiny bit of T3, possibly Cytomel or desiccated pig thyroid, which they love that when I do that. The other providers do.
Oh, yeah, that endears you. They love it. Yeah.
Yes. So yes. And their labs look great and they feel terrible. And that's why they come to providers like you and I who say, well, look at that. Your T3, your T4 is not converting to T3. Right. Now, some patients choose and say, well, what can I do naturally? And absolutely. So some selenium, I'll put some selenium in there, which will help convert T4 to T3. Also helps lower thyroid antibodies, selenium does. And we've got good studies on that for some out of Italy, some here. And so put them on a little bit of selenium, 200 micrograms, maybe, depends. I mean, you got to look and see what all you're taking, or some Brazil nuts to help raise the selenium levels and bring down the antibodies or convert. A little bit of zinc, or maybe some ashwagandha. I mean, there are different ways to convert T4 to T3 in your body. And like you said, also getting your ferritin levels up there, your iron stores, your vitamin D3 levels up there, and your B12 levels. I mean, this is multifaceted there.
So some people are taking a synthetic medication like Synthroid, and it's not converting. And what we would encourage them, I think you would agree, I mean, you already mentioned it, is that they have a reverse T3, a lab test called reverse T3, which shows if it's elevated, that T4 medication is not even converting into T3. So you could be taking this medication and you never feel any different. And then the other big thing is, as you've mentioned, is making sure that they're checking for free T3, free T4, and checking these things. Because if you don't, you could be on this medication or not be on medication and totally miss the opportunity to fix your thyroid, which is driving so many symptoms that you have.
Absolutely. So a tiny bit of T3 is a game changer for many patients. A tiny bit.
Dani, do you use much Armor or Westhroid or Natrethroid? Is that
I use a tremendous amount of Armor. I used to use a lot of WP. That was my number one. And it's been, of course, off the market for a couple of years now. And Natrethroid. So now we have Armor and NP thyroid that are available consistently. Armor's the oldest. And it contains T4, T3, also T1, 2, I think 5 as well. There's a bunch of thyroid hormones. 3 and 4 are the big ones.
Right.
And it's got the proper amount of T3 and T4 in it for patients. And I use a tremendous amount of it. And so some people don't want to start. I mean, they just want to start a little T3. I mean, this is why it's individualized medicine.
Yes.
I have so many thyroid patients. They are all on something different. It's maddening, but it's great because not, again, like you said, the inside, what'd you say about the insides are as different as the outsides? I mean, everyone's different.
We're different.
And some patients, I have to compound the thyroid medicine at the compounding pharmacy because they need, something special in the T3 and T4 in different levels. And I have a lot of people on compounded thyroid medicine. So, there's more than one way to skin a cat. The bottom line is you have to find a healthcare provider who's going to listen to you. And, functional medicine providers are great at that, but many of us, some people can't afford functional medicine providers. And so find somebody who listens to you. We work for you. It is as simple as that. You're not stuck with me or your health or your primary care provider. You have the right to say, or find a new one, or call the compounding pharmacy. That's what I tell patients to do all over the country. They call us all the time. Can we find somebody like Dani in Syracuse, New York? Or does she know anybody? No, I don't know anybody. But if you call the compounding pharmacist in Birmingham, Alabama, where you are, and say, who's the best at thyroids? Who's the best at hormones? The compounding pharmacists are the ones who know who's actually doing amazing work out there. And people don't even think to call a compounder. Compounders compound hormones and thyroid and all kinds of medicine for you. And they're regular pharmacists as well.
Yeah. Well, so Dani, this is great common sense. We boiled it down. I think we really have, hopefully we've cleared the muddy water. And this is really what your book, Wild and Well, Dani's 6 common sense steps to radical healing, right? That's it.
You got it.
Okay. So it's a mouthful. But what a great title, and is filled with information that takes a lot of these complex terms and conditions and boils it down to where the layperson, someone who's not trained like you and I, can be able to take this information and utilize it and understand it, and then to be able to be empowered to take the steps that they need to take.
It is. It's a common sense book. It's evidence-based. It's got 300 and something references, medical references in it, but it is common sense medicine on my 6 steps to healing. But the entire first part of the book is on adverse childhood experiences, childhood trauma, which we didn't mention is a huge piece of the puzzle in autoimmune disease.
Absolutely.
And so and there's an ACE questionnaire in here, and it's what happens to you before the age of 18 can set you up for a lifetime of chronic disease and autoimmune disease. And as it did for me until I learned and I was able to reverse the storm that was in my body. Now, I think it's a great, but I really do. It's common sense. I wanted it for the lay person or for the healthcare provider to say, golly, dang, she dumbed it down. And I don't mean that at all derogatory, to where all of us can understand it. And that's the way I think. This, none of our patients want us talking over their head. They don't care about their neural pathways that are making dopamine and serotonin and, oh my gosh, your glutamate receptors are on fire. They don't give a rat's ass. They want to know, how do I feel better? Right. What are you going to do to help me feel better? What can I do? And that's what this is about. So I'm thrilled with it. But one thing I did want to say, and we could do it another conversation, you can have Hashimoto's, you can have all the great help in the world and be taking the proper medicine. But if you don't take your medicine correctly, you will not feel better. Correctly. And what I have learned the last 11 years, healthcare providers do not teach their patients that thyroid medicine must be 4 hours. And your insert on Synthroid says this, 4 hours away from iron, calcium, soy, dairy of any sort, walnuts, grapefruits, magnesium, Tums, proton pump inhibitors, 4 hours away. That means no oat milk in your coffee an hour or 30 minutes after you take your thyroid medicine. And most patients, if they would actually take their thyroid medicine the way it is prescribed, but they don't know because all it says is on an empty stomach.
Yeah.
Right.
Yeah,
their levels would get much better and they would feel better because what they're taking is binding to their thyroid medicine. Thyroid medicine doesn't play in anybody else's sandbox. It wants to be all alone and the star of the show.
Yeah.
And patients who take their thyroid medicine in the middle of the night, every night, same time every night, if they wake up every night, they're the ones who do the best.
Yeah. Yeah.
On a completely empty stomach.
Well, Dani, this has been great information. We got to have you come back on when you talk about how the adrenals affect thyroid, how trauma, early trauma, loss of plasticity when you're younger sets the stage for stress to become more magnified and to generate autoimmune disease. So we'll get you back on. We'll get you back on to do that. But for those who want to learn more about you, want to get your book, you got so much great stuff on your website.
Yes.
Free stuff, all kind of resources.
Yes.
So what's the best website for them to go to access all this free material?
DaniWilliamson.com. Yeah. Very simple. DANI, yeah. Williamson.com. Facebook, Instagram, YouTube are all the same. Dani Williamson Wellness. Dani Williamson was taken everywhere. Dani Williamson Wellness. And I put so much free education out every day. It's not even funny. I'm a big believer in teaching and giving back and letting people know, you're not broken. And oh my gosh, you can scroll through my Instagram page and you can find a whole series on thyroid or a whole series on sexual health. And yes, so there's lots of free education. And I do a free Facebook Live. Well, of course it's free. It's Facebook Live every Sunday night too, called Sunday Night Service. And that transfers over to YouTube for people who don't have Facebook. So lots of free education, lots of free.
Great. Well, this has been fun. So we got to do this again.
It is fun. Thyroids are fun.
Yeah.
When they're working great, thyroids are amazing.
Yeah. It really is a lot of fun to talk about. And because you just know if somebody gets it and understands it, that empowers them to be able to get the help that they probably desperately need and haven't been able to find. So this has been great. Well, Dani, thank you so much for being on here. I really look forward to us getting together again in the future and tackling some other topics.
Thank you so much. That was great.